Alright, so we have telangiectasias, broken blood vessels or prominent blood vessels along the rim of the nose here, and some on the cheek. And one of the great things about Pelvic is it kind of brings those out just because of the heat, and a lot of patients wear excess makeup just to cover those. So we go to a different handpiece that's considered a cosmetic vessel electrode. It's extremely small, and it's actually guarded all the way down to its very, very last half millimeter. And the technique that I've learned is that I put a little traction on the vessel, and I touch the vessel with just enough pressure to blanch it. Just tap the energy and literally erase these vessels with very little discomfort. Does that hurt much?
Looks like you're poking me with a needle.
And she's really not even feeling the heat, she's really just feeling the sharpness of the electrode. And they literally erase away. I guarantee these in my practice because they really are coagulated, and it's very, very uncommon for them to come back. What's nice about that tip is it's guarded, so I'm actually placing it through the skin into the blood vessel and not creating a tunnel like a doctor would if he were to just take a needle and try to erase those. And those literally just erased away. Those are larger ones, which can be more difficult, and we can take even smaller ones. Very common in people with bare skin or with rosacea. And many times in the process of doing the Pelvic treatment, we realize that the reason the patient's wearing so much makeup is to cover their red lines, not really for any other reason. So for just a slight bit extra cost, we're able to do a procedure which can cost hundreds of dollars with some of the fancier lasers that only work partially not nearly as well because of their broad wavelength, where this is just delivering micro electrodes of heat. This will get a little blush red just from being poked at over the next few days, but these vessels literally will disappear. And occasionally we've had people happier about getting rid of their red lines than they were about getting their face tightened. Even the larger blue lines that are sometimes present in men's faces, the venous lakes or the purple marks on people's lips, can all be eliminated with this little microtip. And because it is so small, the pain is minimal. So you can see the treated side has no obvious vessels, just red from me poking at it, and the untreated side here, has the mosaic of it only just takes 2 units of energy on pure coagulation. I've experimented over the years and found that 4 makes people jump, 3 still kind of hurt, and 2 is really well tolerated, even though it may make somebody's eye water after a bit. But just a great little extra, considering there's a new device coming out called Vein Away that costs as much as this device does, and all it does is that blood vessel. That doesn't affect the skin tightening at all. Some reason she has none on this side. So great application of the Elman device.